In today's video, I'm going to be talking all about how to prevent blisters. If you've ever had a blister, they are miserable. I've had so many in my life that I became an expert on them, I say jokingly, before I even entered my dermatology residency. Speaking of dermatology, if you like skincare content from a dermatologist, make sure you give this video a thumbs up. Definitely subscribe, turn your bell notifications on, that way you know when my videos go live. And give me a follow over on TikTok and Instagram because I'm really consistent with skincare content on those platforms as well. People think about blisters, they mostly think about their feet, right? Who has had a blister on their feet? Maybe you went somewhere, you walked more than you're used to. Maybe over the summer you went on vacation, you got a blister. It can actually really put a cramp in your style and they can be really uncomfortable. But you can get a blister really on any skin surface, especially in areas where you have skin on skin contact and a lot of friction, or even skin on clothing contact and a lot of friction. Blisters can be prevented essentially by taking measures to prevent chafing. Speaking of chafing, I do have a video on tips to prevent chafing, like between the inner thighs. But some of what I'm covering in this video is markedly different from that because we're talking about blisters. Number one tip is to protect your feet. I suggest wearing socks that are moisture wicking and breathable when you're wearing closed-toed shoes to reduce that friction that would otherwise lead to potential blister formation. This is really important for keeping your feet dry. If there's any excess moisture on the surface of the skin, that puts you more at risk for blisters, that moist skin rubbing up against in your shoe. In some cases, depending on the type of shoe that you're wearing, you may find that you actually benefit from doubling up on your socks. Of course, now in the middle of summer, the idea of wearing 2 pairs of socks, very, very hot. But moving into fall, you know, maybe you bought yourself a new pair of boots and you're gonna wanna break them in for fall. Definitely consider wearing 2 pairs of socks as you break them in. Importantly, make sure your shoes fit properly. I cannot emphasize this enough. If the shoe is too loose or too tight, both are setups for blisters. So make sure they fit just right, a la Goldilocks. You may wanna be fitted for shoes. Our shoe size can change a bit throughout our lifetime, like after pregnancy. So it's definitely worth getting resized at some point. You tend to get kind of comfortable and believe that you're a certain shoe size. Number 2 is keep your skin dry. This is especially important if you are prone to excessive sweating, otherwise known as hyperhidrosis. Earlier this week, I did a video on how to stop excessive sweating. So check that one out if you deal with really sweaty hands and feet. That can put you at risk for blisters in areas of friction. Moist skin is more prone to blister formation. Aluminum chloride antiperspirants can actually be applied to the hands and feet. That will actually help cut down on the risk of blister formation. Best to apply them to the hands and or feet at nighttime. They work better at night. And then the following morning, you can wipe them off. The way antiperspirants work is they cause the sweat in the sweat duct to precipitate and plug up the duct. It involutes, and overall you have less output of sweat. I also suggest putting powder in your shoes to absorb excess moisture to keep the feet dry. I am rather a fan of a powder called Zeosorb. It's a great option for in your feet. It has a little bit of an antifungal in it as well, which can be beneficial if you have sweaty feet. Not only are you at risk for blisters, but you are at risk for foot fungus. So highly recommend that one. It is a great option. Or just plain baby powder. Botox certainly can be helpful, and there are certain oral medications that can help with excessive sweating. If your feet happen to get wet, change into dry shoes and socks. If you're someone who does a lot of manual labor, a lot of work with your hands, every time you wash your hands, make sure you dry them really thoroughly. That excess moisture on the skin will make you more prone to blisters from repetitive hand motions. And again, you can get blisters on your body from friction. So select moisture wicking clothing. Not only will this help with reducing the chances that you develop blisters, but also will help cut down on chafing, and it will help cut down on the risk of heat rash, which is still pretty hot here in Texas. I don't know about where you guys live. Some of you have commented that it's kind of cooling off, but it's still pretty hot. Make sure you're sticking to that those moisture wicking fabrics, changing out of wet socks and shoes, and not leaving moisture on the skin. Number 3 is one of my absolute favorite skincare products, and that is good old petrolatum ointment for lubrication. It could be Vaseline or whatever your favorite brand of petrolatum ointment is CeraVe Healing Ointment, Aquaphor, Vani-Ply. But anyways, what this is going to do is act as a skin protectant, and it will reduce the frictional forces on the skin anywhere where you have a lot of rubbing, like the soles of the feet. I like to use it actually on my Achilles tendon, around my ankles for running. I find for me personally, these are areas where my shoes and socks tend to rub, get a lot of friction, and you can develop a blister there quite easily. Yeah, if you're a runner or you play endurance sports where you're running around a lot, highly recommend slathering the bottoms of your feet with Vaseline. My next tip is to wear gloves while you do yard work or any kind of heavy lifting. If you lift weights or you participate in sport where you have something that you hold like a tennis racket, golf club, make sure you wear gloves to reduce the friction on your hands and keep the hands dry. Again, anytime you wash your hands, make sure you dry them thoroughly. If you deal with excessive sweating, antiperspirants, or seek out medical therapies for focal hyperhidrosis on the palms, that will cut down on the risk of blister formation as well. You can also put some of that Zeazor powder on your hands to keep them dry. A lot of gyms actually provide powdered chalk to help reduce slippage and reduce the risk of blister formation. Let me know in the comments though, I always find the sensation of chalk, it kind of gives me the heebie-jeebies. Let me know if you're one of those. But when I was younger, I used to do gymnastics. I was not good at all, like terrible at it. But I remember they always had this bucket of chalk, powdered chalk that you had to put your hands in for doing the bar. It would always kind of skeeve me out. Break your shoes in ahead of time. You know, like I said, we're getting into the fall months. Maybe you're eyeing some boots or whatever. Make sure that you break them in advance of like an event where you're going to be wearing them all day. If you'll recall, recently I wore a pair of shoes to an event where I had to stand for a long time. I got a painful blister. It was miserable. In order to break your shoes in advance, just try wearing them for about 20 to 30 minutes a day in advance of whatever event you have, gradually working up to wearing them longer. That'll help slowly break them in and cut down on the chances that you form blisters. Another mistake I make all the time, don't do this. If you are gonna run a race, don't wear brand new running shoes, because that is a recipe for a blister. Tip number 6 is they make these very soft bandages, which are actually quite helpful for cutting down on friction and protecting the skin, called moleskin. Consider those, especially if you've got tight shoes that you have to wear for sport and maybe they rub in a certain area. That can really be helpful. They also make these little soft cushion type bandages as well. So those are my tips on how to prevent a blister. But what do you do if you actually get one? How do you treat a blister? Fortunately, most blisters will heal by themselves in about 1 to 2 weeks, so you need to be patient. Keep the blister covered with a bandage, and this can be a little difficult because the blister, of course, you've got a little fluid-filled bubble there. In order to cover it, you kind of want to fold the sides of the bandage in a little bit to allow it to go over the blister and adhere to the skin comfortably. For blisters on the bottoms of the feet or any pressure bearing site, what you want to do is get some of that padding and cut it into a donut with a hole in the middle. Put it on the blister so the blister is coming up through the hole, and then cover it with a bandage. When should you pop a blister? Good question. Do your best to not pop a blister. Within the blister is serous fluid, just clear fluid. But the blister roof is actually like a natural bandage. So you don't want to pop the blister. It actually can put you at risk for infection. In some cases, especially if the blister is really large, it can actually be very painful and tense. In that case, what you want to do is take a needle and sterilize it with some rubbing alcohol and gently pierce the side of the blister. This will allow the fluid to slowly drain out. It'll collapse. That'll give you some symptomatic relief. But whatever you do, again, keep the area covered and keep it clean and dry. Once the blister drains, you want to wash the area with just soap and water, and then put a little Vaseline petroleum jelly over the blister. This will help lubricate it, reduce friction, and help promote healing. One thing you don't want to do though, if and when the blister pops, you don't want to pull off that flaccid blister roof, because it actually serves as a natural bandage for the raw skin underneath. Picking it off can lead to infection scarring, and if you try and pull it off, it actually can just start pulling back to otherwise unaffected skin and create a larger area of skin injury. So instead, again, wash the area with soap and water, rinse it clean, kind of flap over that little piece of skin on over, and then put a bunch of Vaseline down to help keep it moist and clean, and then cover it with a bandage. Now, blister fluid, for the most part, should be clear and colorless, serous. If the blister is infected, however, it may be white or milky white. And you want to be very observant in those cases to look for signs of infection, redness is spreading out around the skin, any pain, and bring it to the attention of your healthcare provider right away. Regardless though, for any blister on the foot, in someone who has diabetes, I do suggest being a lot more cautious and seeing your healthcare provider, especially if you have underlying factors that predispose you to infection, especially on the feet, like neuropathy or poor sensation, loss of feeling, poor circulation, and high uncontrolled blood glucose levels. Those are risk factors for skin infections and more involved problems with a blister. All right, you guys, those are my tips on how to prevent a blister and how to treat one if you get it. I've had many on my feet over the years. They do heal on their own in about 1 to 2 weeks. I hope this video was helpful to you guys. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.